What if we told you that criminals tried to steal nearly $15 billion meant for healthcare, and over 300 people, including medical professionals, have just been charged? This is being called the biggest healthcare fraud crackdown in U.S. history, and the details are staggering. The U.S. Justice Department has announced what it calls the largest ever crackdown on healthcare fraud in American history. In a sweeping investigation involving both state and federal law enforcement, more than 320 people have been charged in schemes amounting to nearly $15 billion in false claims. According to officials, these cases span across the country and include nearly 190 federal cases and over 90 at the state level. The fraudulent activity uncovered involved fake medical services, false billing, and kickback schemes targeting government-funded health programs. Among those charged are nearly 100 licensed medical professionals, including doctors, nurses, and other healthcare providers. Authorities say their involvement ranged from submitting false Medicare and Medicaid claims to facilitating the use of stolen patient data. In one of the largest cases, prosecutors uncovered a complex scheme involving medical supply companies that allegedly submitted billions in fraudulent claims for items like urinary catheters. Investigators say the operation used straw ownership and false identities to conceal the true individuals behind the fraud. Nearly 20 people have been arrested in connection with this particular case, including some at airports and border crossings. As part of the overall effort, law enforcement has seized over $245 million in assets, including luxury vehicles, cryptocurrency, and large amounts of cash. Officials say the scale and sophistication of these operations show that many of them are driven by well-organized criminal groups, rather than isolated individuals. Government leaders emphasize that this type of fraud directly harms American taxpayers and patients who rely on public health programs. They reaffirmed their commitment to protecting the integrity of the healthcare system and ensuring that those who attempt to exploit it are held accountable. This coordinated effort highlights the importance of continued vigilance and oversight in the medical billing industry and the serious consequences for those who abuse it.